right, Dr. Ranjan, I want to come back to you because, many who say that this trend is particularly on the rise in the post-COVID era. Now, medically, there has been no link established between COVID and why this is happening among the youth. But your word and any precaution that one can take, especially those who've suffered from COVID, have had severe COVID or long COVID, should we particularly look out?
Uh, so, COVID is a viral disease. Like any viral infection, COVID also can affect every place in the body. Even a cough and a cold, which we generally have, which is maybe a non-COVID virus, can also result in us having multiple problems in our body. Now, what COVID or other viral infections end up doing is they cause a little inflammation of the heart, or what we call as myocarditis. Now, once you develop a myocarditis, once you develop inflammation, there's always a chance of you developing some electrical activities which can be cause short circuit in your heart, and which can lead to your heart getting suddenly stopped, or they can also lead to swelling of your heart, or what we call as cardiomyopathies. So now these are multiple things which can not only happen because of COVID, but for any viral infection. People who have suffered from COVID, all we request them to do is please make sure that you visit a doctor on a regular basis. We go to our tailors, we go to our saloons, we go to everywhere on a regular basis, every fortnight. Why is it wrong to go to a doctor and get yourself checked up? You don't need to maybe have a lot of risk factors, but just get your routine baseline health checkup done so that we know what are your risk factors. You will never know if you're a hypertensive until and unless you get your blood pressure checked. 95% of the patients who will come to us never know they are hypertensive until unless they come to us and we check their blood pressures. Almost 80% of the patients who by the time reach us have very so uncontrolled diabetes, they've developed complications like renal failure, cardiac problems, gangrene of their legs. So this has already happened. So what we need to do is to make sure that we catch up all these symptoms, all these risk factors way before they have already affected us. So any patient, as you said, COVID, who's had a long lasting COVID or who's had non-COVID as well, irrespective, I think all of us ended up having COVID at some point of time in those two waves. So any patient should come down, get your baseline investigations done,
Right.
make sure that the risk factors which are responsible for a heart problem are checked, and then have a regular follow-up. Basic investigations like ECGs, echoes, and a treadmill or a stress echo can actually determine how at risk you are of a cardiac problem. But we need to go there. We need to enter the hospital, meet the doctor, and just talk to them and get these investigations done. That is where we are lacking. The lacuna lacks there. We all feel we are fit.
Right,
We
right.
all feel we are fit, but we are not, maybe,
I wanted
until
to
unless we have.
I wanted to take the same point to Dr. Gupta. The one thing we've established in the last 20 minutes, just because your body is in shape, just because you're going to the gym and you look good does not establish that you have a healthy body, and you need to regularly go through those checkups. But there are a ton of these supplements in the market, and your gym trainers will always tell you they're safe to consume. Your view, Dr. Gupta, on it, and then Dr. Ranjan, I'd like your view on it. Dr. Gupta first.
So that's an important point that, these are people who are in the limelight, who possibly have the best of the best in terms of treatment and lifestyle options. But, I'm not privy to the personal medical history that all of them carry. Were they having diabetes? Or were they pre-diabetic? Or were the family history? Were they smoking? What else was going on? How was the sleep pattern? So these are some of the important things that can lead to heart disease. And till we don't know the personal history, it's difficult to talk about it. Also, a lot of it is just hypothesis as to why they died, right? I mean, if they had a cardiac arrest for any reason, it could be a blood clot, it could be an aortic dissection, which is a tearing of the main artery of the heart. And all of that will get confirmed once you have a autopsy done, which is not very often done in our setups. So, an autopsy is the only way to confirm what the exact cause of death was. Because, like I said, at the end of the day, whenever anybody dies, no matter if they died of for whatever reason, whether it's malignancy, whether it's heart disease, whether it's kidney problem, or even a cancer for that matter, the way everybody dies is they die in the end of a cardiac arrest. That's how you know somebody's died, is when the heart stops beating. So, why it stopped beating is something that you will come to know only after an autopsy or some forensic evidence is available.
All right, Dr. Ranjan, with regards to these supplements, whey protein, protein intake, which protein is safe, what is not safe, in how much quantity does it suit your body? Because your gym trainers can tell you as much, but you know, we have to be very careful of these things because they may not show up any side effect in the short term, but the long term damage, how imminent is it?
So again, the question arises is, do we really need them? Do we really need those synthetic proteins in our system? Why is it so difficult for us to consume natural proteins? Now, as one of our panelists was saying, the kind of profession you are, these people are in a profession where looks matter, where the way you are dressed matters. So it is what looks makes a difference. Now, for them, it becomes very important for you to have that kind of a physique or a body. The question still remains, all these synthetic products are somewhere or the other not right. We've been made to have natural products. Why can't we just increase on slight amount of proteins? Do we really need to have that kind of a physique? Do we really need to stretch ourselves that much that our physique is that well that we're consuming something which is not meant for our body? And still, most of our gym trainers, I'm sure these people are, these celebrities have the best of the best. But look at the common person. Most of the gym trainers in a common gym do not have any idea. Forget about a underlying cardiac disease. They do not have any idea about diet. They do not have any idea. There's so many patients who end up with us with bad disc slips, disc prolapse because they just lifted heavy weights without any training. They have underdiagnosed heart conditions and they suddenly drop dead in the middle of doing a treadmill. So these supplements, these gym supplements where we are running after to trying to make ourselves look better, I think our race is more towards the looks rather than trying to make ourselves fitter. We want to look better. Our race to that I am more good looking or I'm more muscular or I have a more six packs than the colleague next to mine is far more than trying to make sure that I'm fitter. So there's, as I said, there's a huge difference between your age and your biological age. You might look be 20, but your biological age, because of all these lifestyle problems, might be at least 42. So you might be looking with all your plastic surgeries and with all your aesthetics which you're trying to do, you might look younger, but the way you're trying to treat your body is making you very, very old. And that is what is going to land up you into a problem. So let's not run after
Right.
all these cosmetic things. You need to understand what your body is. You need to understand how you can be the best of the best and the fittest of the best.
Completely agree with you. And this mental conditioning is so important to feel comfortable in your own skin. Dr. Gupta, if I could come to you on what the possible checks can be for fat blockages, calcium deposits, stress levels, because that is one of the highest factor that is responsible to lead to a condition like this. Details on specific tests one can do.
Yeah, so there are different types of tests available which give you an idea of the blockages that are there and are they significant or not. And there are a whole host of tests, right from a stress test to a Thallium stress test to an echo stress test, cardiac CT angio and angiography. So there are these whole host of tests that can be done, but they should be done after an advice is taken from a physician, from a healthcare practitioner, and people should not just opt to go for it prophylactically by themselves. It's important to have a doctor discuss your lifestyle, discuss your risk factors with him or her, and then ask them that, do you think I need any of those tests available to determine if I have blockages or not? So I think it's a graded protocol, and that protocol should be followed. People should just not do it themselves after reading online.
All right. I'd like to thank both you gentlemen for joining us this evening and bringing clarity to what one can do to stay heart healthy. Extremely important given the lifestyle we have in today's day and age. and the stress level that is particularly high, can't help it. But how can we possibly prevent this sort of a condition? I want to thank you all for staying tuned.